Well, the UAPD was actually founded by a private surgeon in San Francisco, Dr. Sanford Marcus. At that time, most professional people, especially doctors, didn't really consider themselves workers, so they weren't really interested in joining a union.
I started with the UAPD in 1975. It was a transition period when managed care was coming in, the HMOs and big insurance companies. And then in California, they increased the malpractice insurance rates by 500% in 1 year. And Dr. Marcus, the union's founder, was incensed. He said, we can't do this alone, we have to have a union.
I started January 8th, 1973, and when I started, there wasn't even a chair. Dr. Sanford A. Marcus was a wonderful speaker. Everywhere he went, people listened to him and the message that he was giving that doctors need a union. It was not welcome by the medical associations, but Dr. Marcus persevered, and here we are today.
The AMA president responded, no way.
But Dr. Marcus and his wife had to sit at their kitchen table in the San Francisco area, stuffing and writing envelopes, thousands of envelopes, to all the doctors in the San Francisco area, urging them to join this idea of a union. And lo and behold, he got hundreds of responses with very meager $25 initiation fees. With that seed money, Dr. Marcus was able to get a charter and get a rental space in the San Francisco Ferry Building. That was the birthplace of our first of the Union of American Physicians and Dentists. In 1975, UAPD faced its first real challenge. The malpractice premium rates across California were skyrocketing. All the doctors were complaining. UAPD seized the moment, and Dr. Marcus organized about 2,000 doctors to protest these untenable malpractice premiums. We organized a picket and eventually went on strike for 28 days, which was the first licensed physician strike in the history of the country. It was very effective, and Governor Jerry Brown soon signed a reform of malpractice premiums.
Dr. Marcus was the founder of the union, and it started off with private practice doctors, but he quickly realized, he was smart enough to know that we have to organize the employed physicians. That means county doctors, state-employed doctors, university-employed doctors. And he did. During his tenure, he recruited thousands of doctors into the union. Robert Weinman started his tenure in around 1990 when Dr. Marcus retired. Weinman was very politically savvy, smart, and a very well-known figure in the media. He was the one who introduced the Patient's Bill of Rights, and that put UAPD on the national map.
As a result of Congress's failure to act on the Patient's Bill of Rights, millions of patients are still deprived of protections. So long as we have decisions being made by these people as to who can treat sick patients, we do not have a medical care system. We have instead a new investment portfolio. And that's not what health care is all about.
So the first two public sector union that was able to join the UAPD was San Francisco and San Mateo. And San Mateo, we were able to increase their physician salary by 20%. And San Francisco was the first county we were able to get the physician involved in their county pension plan. So we were very successful in that matter, and it was the beginning of the UAPD organizing the public sector.
The longest and most difficult drive that we were ever involved with was Los Angeles County for sure. In the 1970s, we organized psychiatrists and dentists. But in the 1990s, we decided to go after the 800 primary care doctors and physicians.
In Los Angeles County now, you won't have to look far for the union label with doctors.
Today is the day that we physicians begin the process to take back the practice of medicine throughout Los Angeles County.
Even though we negotiated over 30 articles, tentative agreement in the MOU, the negative results for the enhanced benefit The physician want to decertify after all, and UAPD filed several unfair labor charges and brought lawsuits. Also, UAPD had to go to the legislature and lobby. UAPD joined and become affiliated with the National Union, American Federation of State, County, and Municipal Employees. And there was a lot of help that we were able to gain with the legislature. And we were able to, since then, have a physician pay rate increase within a grid. Also, there's a physician registry set up for premium pay for extra work. And then there's also the setup of a union benefit fund that gives a lot of innovative benefits. There are many more. There's also the just culture that is now able to guard the labor and management relationship and increase morale.
After we won the collective bargaining was signed into law by Governor Brown in 1981. That's when we organized the doctors belonging to the states, and not only physicians, but fields like podiatrists and dentists were also added, and the letter D was added to the UAP. When we had added dentists, that's when it became UAPD. In the first negotiations with the state, the UAPD got good benefits for the physicians, wage increases, better work conditions. We also established a grievance procedure to enforce the contract. In 1991, Governor Wilson tried to get rid of the collective bargaining that UAPD defended against aggressively and won. Whoever is the governor of California, UAPD has consistently brought all the battles to the front. We have fought against contracting out, against layoffs, and we have even picketed to get the doctors' rights. In 2010, the state tried to contract out the entire prison system to a telehealth company. Dr. Bussey, myself, and our attorney, Andy Kahn, we went to the university's meeting of UC Regents and aggressively fought against it, and it was successful.
1990s, there were a series of lawsuits that concluded that unconstitutional mental health, medical, and dental care was being provided in the prison system. The prison doctors and state labor unions were being blamed for that. So UAPD launched a vigorous defense. They came to the defense of physicians. They created a comprehensive prison reform act from scratch. Eventually, Judge Henderson appointed a federal receiver to take over the management of CDCR healthcare system. UAPD negotiated with the receiver's office to protect physicians' due process rights. The receiver realized that doctors had some good ideas about staffing and healthcare policies to improve the quality of care in the prison system. Salaries got better and CDCR was able to recruit. Let's talk about today. Salaries are starting to lag. PEPRA pension reform that was signed into law in 2013 has had a big impact on physician recruitment. We're standing together, we're protecting each other, and we're fighting for all the physicians in the state.
The Higher Education Union was organized during 2013. We were able to organize California State University physicians and the UC, University of California physicians as well. During 2013, when we were organizing at that point, they forced the union hand to strike, and nobody wants to strike, but we had to strike in order to get the contract that we needed. The strike allowed our California State University physicians and UC physicians to get higher benefits and high salaries.
In 2012, there was an amendment in the Constitution of UAPD bylaws. It expanded from dentists, doctors, and podiatrists to a growing number of pharmacists, nurse practitioners, physician assistants, and even veterinarians. All of us joined the UAPD family.
In 2002, when I first joined the union, we advanced a piece of legislation called Assembly Bill 2006. That was sponsored by Assemblyman Gil Cedillo. That bill was critical to our LA County members. So we introduced legislation here in 2002 that said that you cannot lose these benefits if you become part of a bargaining unit. It was signed into law by former Governor Gray Davis. It took us 5 years in and out of court to secure those benefits and to get back for our membership. 5 years later, we were awarded over $10 million in benefits for our members. That is one of our significant victories that we've had on behalf of our members here in Sacramento. We've protected scope of practice. We've expanded the role of physicians in the workplace. We've protected their rights. We've worked hard for compensation for doctors who work in difficult venues, be it the prisons, state hospitals, and other trying circumstances. Why is politics important? If you are not at the table, you are on the menu. We've been here 50 years fighting for physicians, dentists, nurse practitioners, PAs, and other mid-level and other practitioners throughout the state of California. We're now in New Mexico. We're now in Washington State. We are growing, and this is a movement.
Well, UAPD's charter actually enables us to organize across the United States. And we have organized doctors in Washington State, New Mexico, and several other states are asking for our help. In Seattle, Washington, for instance, in the last few years, we successfully modified a very contentious closing policy, and we did that with bargaining, lobbying, picketing, and even 2 strikes. The employers in these states are private, well-funded, and very tough-minded. It's a real challenge for us. The other challenge is the COVID pandemic, which is just, still rages on, and that's really changed the landscape of healthcare in the realm of telemedicine, physician autonomy, free speech, and the ability of doctors to speak out. As UAPD launches its next 50 years of solidarity and service to healthcare professionals, physicians, and the communities that they serve, we pledge to stand up for those healthcare professional rights and autonomy and never give up the fight.
Now, if you want higher wages, let me tell you what to do. You got to talk to the workers in the shop with you. You got to build you a union, got to make it strong. But if you all stick together, boys, 'twon't be long. You get shorter hours.